Hi, I'm Delegate Patrick Hope, and want to welcome you back to week 2 of the legislative session in the Virginia General Assembly. This was another busy week in Richmond, but I want to use this opportunity to discuss an initiative that I've been working on for the past year, and that is to seek meaningful mental health reform in Virginia's jails. On Wednesday, I held a press conference with the family of J. Michael Mitchell to announce bipartisan and comprehensive reform of mental health in Virginia's jails. J. Michael suffered from bipolar disorder and schizophrenia. He died from heart failure accompanied by severe weight loss in the Hampton Roads Regional Jail. Mitchell was jailed in April of 2015 on charges he stole a Mountain Dew, a Snickers bar, and a zebra cake from a 7-Eleven in Portsmouth. He was ordered to a state mental hospital, but his paperwork was stuffed in a hospital employee's desk drawer, and he was never sent there. He died at the Hampton Roads Regional Jail about 4 months later. Some of the bipartisan legislation that has been rolled out include proposals to require same-day access to mental health screening services and follow-up assessments for individuals identified as being in need of behavioral health care. The governor has included more than $20 million in this year's budget to pay for mental health services. I've introduced legislation to require that a defendant who is found incompetent to stand trial for a crime and who was ordered to receive treatment to restore his competency at an inpatient hospital be transferred to that hospital no later than 10 days from the issuance of that court order. If J. Michael had received inpatient hospital treatment, he would still be alive today. I've also introduced legislation that authorizes a law enforcement officer who arrests a person for a misdemeanor offense who the officer believes has a mental illness to transport such person to a crisis stabilization unit. Experts will tell you that the worst possible place for someone with a mental illness is in jail. Had J. Michael gone to such a facility, he would have received the mental health treatment he needed. Other bills would have likely prevented J. Michael's death that we're rolling out includes putting the responsibility of the person having custody of an inmate to ensure that such inmate actually receives an evaluation or assessment required. And still another would require mental health first aid training for sheriffs and officers to be able to recognize when someone is in crisis and take steps to get them the mental health treatment that they need. And finally, we rolled out a bill that would require an inmate's Medicaid eligibility to be placed in suspension rather than termination during incarceration in order to ensure that upon release, they continue to have access to Medicaid services. These are bipartisan proposals that will go a long way towards solving our mental health crisis in our jails. In order to avoid any further preventable deaths like J. Michael's, we must act in this session. Well, that's all for this edition. Thank you for listening, and we'll see you back here next week.